Hello everyone. Today we are going to talk about the diagnosis of pregnancy. Now, what is the meaning of diagnosis of pregnancy? When the mother is having the pregnancy, at that time we have seen what kind of physiological changes are coming. So, if the system and organs are going to change, then of course she will be developing some sign and symptoms. Okay. So, what kind of sign and symptoms will be there during the pregnancy that we are going to talk about? So, let's see. In that, first of all, we'll see the introduction. So the antepartum period covers the time of the pregnancy. So here, what is the meaning of the antepartum period? It means that the antenatal period. So from where the mother is going to conceive the pregnancy till the 9 months. So that is known as the antepartum period also. So here it has written from the first day of the last menstrual period. So the last menstrual period is there. That day we have to come from that. First day we have to count, so till the 9 month. So to the that is last menstrual period, that is known as a LMP. Okay, so if someone asks what is the full form of LMP, so you should understand and you should give the answer, that is the last menstrual period. So to start of the true labor pain. So till what we can consider as an antepartum period, so it has written the last day of the menstrual cycle, that will be that we will be counting first day, and till the true labor pain is starting. True labor pain means that the baby is about to deliver. So that kind of pain occurs, till that we have to consider that period is known as a antepartum period. So which mark the beginning of the intrapartum period. Now what is the meaning of intrapartum? Intrapartum, it means that the labor process. Okay, so labor process we can consider from when the true labor pain is going to start, from that point of time to the delivery of the placenta. So this period will be known as a intrapartum period. So here we have seen the two terminology, that is the antepartum and the intrapartum. Antepartum, it means the 9-month pregnancy. Intrapartum, it means the labor process. Okay, and the postpartum. Postpartum, it means that after the delivery, the period is that the 4 week of the after the delivery, that will be considered as a postpartum period or the normal puberia. So that is about that. Now the antepartum period is divided into 3 trimesters. So here the whole month, we can say the 9 months are there. Okay, so whole pregnancy, or we can say the antepartum period, is divided into 3 trimesters. So that is the first trimester, second trimester and the third trimester. So here each consisting of the approximately 13 weeks or the 3 calendar months. So here the 3 we can say the 3 trimesters are there, right? So it will be containing the almost about the 3 months. So we can say the first trimester will be containing the 3 months, second trimester will be also containing the 3 months, and after the third trimester, that is also the duration will be the 3 months, or we can say in a weeks it will be about the 13 weeks. So this derived from the calculation of pregnancy as begin approximately 280 days or the 40 weeks from the last day of the menstrual. So here what happens, what it has written, that it is going to derive. Now how we are going to calculate that? Okay, because 9 months as we know, but in days how much? So here it has written approximately 280 days will be counted, or else we can say the 40 weeks. So here the term delivery we used to say, so that is from the 38 to 40 weeks of the pregnancy. So in reality the gestation is not too long, so that is depend on the physiology of the mother also. Okay, but most probably it will have the 38 to the 40 weeks. Okay, or we can say the 280 days, otherwise 9 months. So here in short we have talked that 9 months are divided further into 3 trimesters, right? First, second and third. First trimester, or we can say the each trimester will be containing, or will be the duration will be the 3 months. Okay, then after fertilization take place at the time of the ovulation. So here the ovulation is when is happening, that time only the fertilization will be there. Why? Because during the ovulation the Graafian, the mature Graafian follicle is there, From that, the mature ovum will be rupturing, and the fimbria is there that is going to catch the ovum, and that is going to transport it to the fallopian tube, or we can say the ampullary part of the fallopian tube. So that is known as the ovulation. So when the ovulation is happening, and that time if the intercourse is being happened and the sperm entry is there, so after that the fertilization will be there. So approximately 14 days after the LMP. So most probably fertilization, when it takes place after the LMP, it takes about the 14 days. So this makes the actual gestation approximately 266 days or the 38 weeks. So here it has written we have seen earlier it was 280 days, right? So in that we have to count the 14 days of the fertilization also. So adding the 14 days gives a total of the 280. Okay, if we add this, so if 266 plus the 14 days of the fertilization, so what will come? 280 days from the LMP. So from LMP, the last menstrual period is that day we have to count as a day 1. So in the practice, the first term is generally considered to be the 1 to 12 weeks. So here we are going to consider the first trimester. So here specifically how much duration will be counting for the first trimester that we are talking about. So first trimester will be generally, that is from the 1 to 12 weeks. Okay. Then after the second trimester will be the 13 to the 27, and after third trimester will be from the 28 to the 40 weeks. So this is how the trimester will be divided. Then after, pregnancy may be diagnosed by the woman herself even before she missed a period. So here what it has written, even though the mother will be feeling that she is pregnant. Why? Because the changes will be coming from the ovulation, or we can say from the fertilization. Why? Because all the hormones will be secreted and all the changes will be coming inside the body of woman, right? So whatever the changes are coming, she will be experiencing first by herself. Okay, so after that, if she is missing her period, she can go for the confirmatory test. Then after, even though it has written, even though if she don't miss a period, she will able to understand that I am pregnant. Then after, she feels different. Why? Because why she is going to feel different? Because whatever the hormonal changes are there, due to that she will be feeling this. So changes in the breast can occur as early 5 to 6 weeks after the conception. So what happens after the conception or after the fertilization, it takes about 5 to 6 weeks for the breast changes. Okay, so that kind of heaviness and the pricking sensation and the changes in the shape and size of the breast, she will be feeling this all the changes. Then diagnosis of pregnancy in the first trimester and early second trimester is based on the combination of presumptive. So here it has written the diagnosis of pregnancy that will be in the first trimester and early second trimester. So that is depend on the combination of different symptoms are there. So here what kind of symptoms our mother are developing, that they have divided into 3. So that is the presumptive sign, probable sign, okay, and then after the positive sign will be there. So as I have told, the whatever the changes are coming inside the body of the mother, right, the physiological changes also, or systematic and the organ changes, so that will show some sign and symptoms to the mother. Okay, so that they have divided into 3: presumptive, probable and the positive. So pregnancy is self-evident later in the gestation than when the positive sign of the pregnancy are readily observed. Now we'll see what is the little meaning, we can say a brief regarding the presumptive, probable and the positive sign. So here first one, that is the presumptive sign. So what it is? Of the pregnancy are maternal physiological changes which the woman experience and which in most cases indicate to her that she is pregnant. So presumptive sign, what we can consider, which kind of sign and symptoms, which is going to have a physiological changes inside the body. So whatever the changes are coming like the physiological, that will be considered as a presumptive sign. Okay, and that is everything will be the mother is going to experience. Okay, and that will indicate that she is pregnant. Then after probable sign, so what it is? Are the maternal physiological detected on the examination or documented the sign and symptoms by the professionals? Okay, so here it has written like that. Okay, for confirming the pregnancy, we will be doing some test. Okay, so by doing the examination, okay, or we can say the documenting. Okay, by that only we can understand. Okay, she is pregnant. Okay. Now the positive sign, so those directly attribute to the fetal changes other than the presumptive sign which examiner has detected and documented by the examiner. So here whatever the test we are doing, that will be coming under the positive sign. So that will be done by the examiner, or we can say by doctor also. Now we will see each one which kind of sign and symptoms will be there inside this. So first one is a presumptive sign. So abrupt cessation of the menstruation, that is known as amenorrhea at the 4th week. So we can say she is going to miss her first period. So that is known as a abrupt cessation of the menstruation. It means that the menstrual cycle is going to be stopped. So that is known as a amenorrhea. So at the 4th week, she will have this sign. Then after the nausea and vomiting, that is known as a morning sickness. So as that will happen, why? Because of the hormonal changes is happening inside her body. So due to that, she will have the morning sickness. So when she is getting up of the bed, that time she will have she is feeling vomiting like that. So that is what. So that's why it has said the morning sickness. From the 14th to the 4th to the 14th week. So this kind of symptoms will be coming from when? From 4th to 14th week of the pregnancy. Then after the tingling, tenderness, nodularity and the enlargement of the breast. So as you have seen earlier, from the 4th to 8th week, the changes will be coming inside the breast, right? So what she will be feeling? Tingling sensation. Then after the tenderness, so the tenderness or the hardening a little will be there. Then after the pricking sensation, so that kind of things she will feel. Then after the enlargement of the breast, even though the size of the breast is also going to change. Then after enlargement of the nipples around the 3 to 4 weeks. So here what happens? The nipples are that is also going to enlarge. Okay, so that will happen when the 3 to 4 weeks. Then after the increased frequency of the micturition, that is the what it means? The mother will feel she wants to go for the frequency of the voiding will be increasing. All the time she wants to go to the washroom. Okay, why? That will happen. Why? Because bladder irritability. That is also going to happen because of the hormonal changes. So that will happen around the 6 to 12 week of the pregnancy. Then after the fatigue, so mother will feel fatigue. Why? Because whatever the changes, the physiological changes are being happening inside her body. So that's why she will feel like the fatigue, the weakness kind of she will be feeling. Then after the color change of the breast. So even though the color of the breast is also going to change. So what will happen? So darkening of the nipples, primary and the secondary areola changes. So here the primary and the secondary areola, they are going to change the color of that. Okay, so that is happened because of the hormones only. Then after the appearance of the Montgomery tubercles. Now what is the meaning of Montgomery tubercles? We have seen in the previous lecture also that the small dot like structure is there over the nipple. Okay, so in that the small dots are there, that is known as a Montgomery tubercle. So for the non-pregnant mother, or we can say for the non-pregnant lady, it won't be a prominent. But when she conceives a pregnancy, that time this tubercles or this small structure is going to be a prominent. Okay. Then after continued elevation of basal body temperature. So here the body basal temperature is that is also going to be increased, or we can say the elevation will be there. Sometimes it can be the less also, sometimes it can be more also. So that is even though absence of the infection. It means that the mother is not having any kind of the infection, or we can say that there is no any presence of the microorganism. But still her body temperature is more. Why? Because that is happening, that is happening because physiological changes and the hormonal changes are there. That's why. Then expression of the colostrum from the nipple. So when the mother is pregnant and the antenatal period is there, that time if you try to express the milk from the breast, that time it can happen. So that is known as a colostrum. Then after excessive salivation, even though the mother will produce more saliva. Why? Because that will happen because of this hormonal changes also, and the metabolic rate and everything is also going to change. Then after quickening, now what is the meaning of quickening? So that is the first movement felt by the mother around the 18 to 20 week. So when the mother is having the 18 to 20 weeks, she will feel the fetal movement. It means that the fetus will be moving inside the womb or inside the uterus. So that's why she will feel like the baby is kicking or baby is changing the position. So that is known as a quickening. Then skin pigmentation and condition. So here what happens, the skin color, that is also going to change, or even though the stria gravidarum and after the linea nigra, everything will be changing that color. So skin pigmentation and condition such as chloasma. So that is known as a pregnancy mask. Like the butterfly structure mother will be producing, or that will be creating over the cheeks, over the head, the forehead also, okay, or sometimes the chin also. So that is depend on the physiology of the mother. So that will happen. Why? Because of the melanocyte stimulating hormone. Then after the breast, even though in the breast, primary, secondary and the tertiary areola, the changes will be coming for that also. Then after the abdominal stria, the stria gravidarum are that is also going to change. Then after the linea nigra, so linea nigra, it means that the straight line which is starting from the umbilicus to the symphysis pubis. So that line is also going to be a prominent one during the pregnancy. And after the palmar erythema. So that was till now we have talked about the presumptive sign. Now we'll be talking about the probable sign. So which kind of sign mothers are producing, and that will be counted in this, we'll see. So probable, it means whatever the physiological changes are coming inside the body of the mother, that will consider in this. So first one is the enlargement of the uterus. Of course, the uterus is the one who is going to provide a shelter to the baby, right? So the changes will be coming inside the uterus only. So all the muscles and the muscle fiber and the tissues, and we can say everything is going to layers, and the skin, everything is going to change of the uterus, right? Then after change in the shape of the uterus, as we have seen in the physiological changes, so at the different stage of period, the uterus size and shape is also going to change. So when it comes for the first and second trimester, okay, first trimester there won't be any much changes in the shape and size, but when it comes to the second and third trimester, the shape and size will be increasing a lot. Then presence of the human chorionic gonadotropin, that is known as a HCG, in the blood. So when it will be secreted, or when it can be tasted on the 4 to 12 week of the pregnancy, and even though 6 to 12 week for the urine. So as you can see here they have shown that the HCG will be produced first at the blood. Okay, so HCG will be first it will secrete in the blood, then after it will be secreted inside the urine. So that's why it will come the positive pregnancy test. So at that point of time, if mother is running any pregnancy test, that time that is coming positive. Why? Because of the presence of the HCG hormone. Now what is the meaning? Now what is the Hagar sign? So softening and the compressibility of the isthmus, that will happen by the 6 to 12 week. So here Hagar sign. So here the cervix is there, that is going to become a soft. So that is also one sign, that is known as a Hagar sign. Then after Jack-Meyer sign or the Chadwick sign. What is that? Jack-Meyer and the Chadwick sign. So the violet or blue discoloration of the vulva or the vaginal mucosa, So here what is going to happen, the vaginal wall is there, or we can say the mucosa, that is going to have a violet or the bluish discoloration. Okay, so that is known as a Jacqueminot or the Chadwick sign. So that is happening including the vaginal portion of the cervix due to increased vascularity. So why that is getting the bluish coloration? Because there is going to the mucus is there, or the vaginal wall is there, that is going to have more circulation, blood circulation. That's why it will have the bluish coloration, evident by the 6th week of the gestation. So it will happen, or we can say we can check if we do the examination, that time this kind of bluish coloration can be seen. So that will come on the 6th week of the gestation. Then after Occipital sign, now what it is? So that is a pulsation in the lateral fornix. So lateral fornix is there. If we insert the finger, that time we will feel the pulsation over there. So that is known as a Occipital sign. Then after the Palmer sign, what it is? So that is a regular, rhythmic, painless contraction resembling a systole and the diastole of the heart that can be elicited during the bimanual examination in early as the 8th week of the pregnancy. So here what happens? So the uterus is there, that is going to create some kind of pain. So that is the pain which uterus is producing, that is known as a uterine contraction also. Okay, so here it has written that is going to make, or when the mother is pregnant, that time the pain will be regular, rhythmic, and the painless will be there. Okay, painless contraction, it means that the dilatation of cervix won't be there. If the this pain is this contraction is painful, so what happens? The cervix dilatation will be there. Okay, so during pregnancy there should not be a dilatation of cervix. Okay, why? Because if the cervix is dilated, so what happens? Premature delivery can be there. So this kind of contraction will be coming, okay, when you do the examination, that time the mother or you can feel also. So that is known as a Palmer sign. So that can be detected on the 8th week of the pregnancy. Then after the Goodell sign, now what it is the meaning of the Goodell sign? So softening of the cervix from a non-pregnant state to the firmness similar to the tip of the nose, to the softness of the lip in the pregnant state. So from the 6th to 8th week. So here what happens? So cervix are there, that is going to become a soft. Okay, so softening of the cervix, that is known as a Goodell sign. Then after presence of the Braxton-Hicks contraction, so Braxton-Hicks contraction, so that is also we can say that is a painless, rhythmic, there won't be any rhythm. Okay, and there it will be an irregular one. Okay, so that kind of contraction is known as that will be felt by the mother itself. Okay, but Palmer, in that you can say when you are doing the examination, that time you also going to feel that kind of contraction. But here the Braxton-Hicks contraction is there, that will be felt by the mother only. Then after that will be seen on the 16th week of the pregnancy. Then after the ballotment of the fetus, now what is the meaning of the ballotment? When the head is engaged in the pelvic cavity. So when the baby is coming to descend down, okay, during antenatal period, the baby will be in the false pelvis. Okay, but when the true labor pain is going to start, that time what happens? The baby will be descend down. Okay, so descend down, it means that the baby is going to come into the cavity of the pelvis, right? So when it is going to fix, or when it is going to engage the presenting part, that time if you keep your hand over the symphysis pubis, okay, and if it is if you are able to grasp the presenting part, so it means it is a ballotment. The ballotment is there. Okay, and what is the meaning of blotting, or we can say it means the floating. Okay, floating, it means that the head is not engaged. It means the baby is floating, or baby is swimming inside the amniotic fluid itself. So ballotment of the fetus can be done on the 16 to 28 week of the pregnancy. Okay, so now we'll be talking about the positive sign. So what is a positive sign? So in that, most probably we will run all the tests for confirming the pregnancy. So in that, visualization of the fetus by the ultrasound. So when the mother is missing her period, and at that time if you go for the ultrasonography, so that time you can see the growth and development of the baby. So that can be done on the 6th week and above. So if you go for the ultrasonography, that time you can see that. Okay, then after visualization of the fetal skeleton by the x-ray, so that is from the 16th week. So when you go for the, if mother is going for the x-ray, so that time on the film of the x-ray, she can or the doctor can see the skeletal system of the baby. So that is also positive sign of the pregnancy. Then fetal heart sound by the ultrasound. So when they go for the ultrasound, that time they will be checking the fetal heart sound also, or fetal heart rate also. So that can be done from the 6th week of the pregnancy. Then fetal heart sound with the fetoscope. So what is the meaning of fetoscope? It means that is a one kind of instrument that will be look like a funnel shape, and one end there will be the two end. One end will be keeping on the ear pinna, and another part or we can say the another end has to be keep on the abdomen of the mother. Okay, so by that, and it will be made up of the aluminium. So from that you can listen the fetal heart sound, or we can say the fetal heart rate. Then after palpable fetal movement, that will be the from the 22nd week of the gestation. So that time the fetal, from that point of time, the baby will be moving inside the womb. So fetal movement will be felt at the 22nd week of pregnancy. Then visible fetal movement, even though the fetal movement, if the baby is moving inside the womb, that can be seen externally, that will be from the late pregnancy. It means when the third trimester is about to over, that time visible movement you can see. Okay, then palpation of the fetal part, so that can be done from the 24th week and above. So palpation is so much important for the antenatal mother. So in the, we can say the abdominal palpation, right? So in abdominal palpation, they will be checking the foregrip. So by checking that grip, they will be able to understand the presentation, then which is the position also, which side the fetal head is there, which side fetal spine is there, everything they can check by the doing the palpation. But even though that ballotment and the floating, that also can be done by the palpation. So that can be done from the 24th week of pregnancy and above. Then after, it is not always appropriate to seek finding regarding of the sign of the pregnancy outlined here when the examine a woman who thinks she is pregnant. So here it has written, it is not always appropriate to seek all the tests, whatever it has written or whatever we have listed here, it is not necessary for the woman who is pregnant we are carrying out, which is really important. That only we have to do the test for the confirmation of the pregnancy. So this is because of not all the sign and manifested at the same time. Because why? Whatever the sign we have seen, it is not needed that it will be for every woman. Okay, so sometimes some kind of changes will be there, that is depend on the physiology of the mother also. So here what happens, some women will may experience the morning sickness and some may not experience that also. Okay, so it is also important to know that the majority of this sign can be due to the other condition and diagnosis of pregnancy. So maybe sometime it is also important to know that what kind of sign and symptoms or diagnosis of pregnancy has to be there for the pregnant mother. Okay, then only you can identify it is related to pregnancy or it is related to other condition. Then can be made only in the presence of the several of these changes. So as you have seen the physiological changes also. Okay, so if something is happening like that, then only you can identify that is because of the pregnancy. Now the uterine enlargement. So estrogen and the progesterone are primarily responsible for hypertrophy of the uterine wall. So here the estrogen and the progesterone, that both the hormone are really important, or we can say that is only why the uterus is going to do the changes, or we can say the whatever the changes is coming inside that is due to this both the hormone. Then after, during the early month of the pregnancy, when the early stage of pregnancy is there, that time all the changes will be coming because of the estrogen and progesterone hormone. Then uterine enlargement is result of considerable increase in the size and stretching of the muscle cell. So these hormones are there, right? So that is going to work on the certain muscles. So muscles will be there, that is going to stretch the and the cells stretching and the muscle stretching will be there. That is because of this hormone only. So the hypertrophy of the muscle cell is accomplished by the marked increase in the elastic and the fiber tissue. So that is happening, why? Because the muscle fiber is there, that is going to, or we can say the muscle cells, they are going to increase the size of them, right? So that is going to increase the muscles like elastic and the fiber tissues are there, they are also going to change their size and the shape. So which strengthen the uterine wall. So why they are why their size and diameter is changing? Because if it is happening, so they can support or they can strengthen the uterus also and support the fetus also. Then after the third week of the pregnancy, the uterine enlargement is also due to the mechanical effect on the inside pressure on the uterine wall. So here after the third week of pregnancy, the uterus enlargement will be the more. Why? Because from the second trimester, the most changes will be coming in the baby. The baby's size and shape will be rapidly increasing also. Okay, so that's why if the baby is increasing the size of him or herself, then of course uterus size is also going to change. So the growing product of the conception. In early month of pregnancy, there is a marked increase the size of the uterine blood vessel also, or even the whatever the blood vessels and the lymphatic and every systems are there, that is going to increase their function even though. Okay, so resulting vascularity. Why? Because they has to work more, because they have to give the or they have to provide the blood circulation to the baby also, and for the growth and development of the uterus also. Then after the congestion and edema most likely account for the overall softening of the uterus. So here so what is going to happen during the antenatal period, the uterus will be soft, okay, but when the true labor pain is going to start, that time the uterus will be hard, okay. Why? Because the uterine muscles, everything will be going for the contraction and the relaxation. So this along with the hypertrophy of cervical gland give the rise to the Chadwick and the Jacquier sign and the Hagar sign. Okay, so here what is going to happen? What is the meaning of the Chadwick and the Jacquier sign? That is going to have a bluish discoloration over the mucosa or the vaginal wall. So why it is happening? Because here the vascularity is going to increase. Then the softness and the compressibility of the uterine isthmus, that is known as a Hagar sign. So here what will be happen? The this isthmus, or we can say the cervix, will become a soft. So that is known as a Hagar sign. So has the effect on a non-support enlarging body of the uterus with increasing heaviness in the fundus. So here what will be there? The heaviness of the fundus will be there more. Okay, why? Because all the changes and everything will be coming at the implantation side than the other side. So that's why at the fundal part more heaviness will be there rather than the lower side of the uterus. So the result in the exaggerated uterine and the anteflexion during the first 3 months of the pregnancy. So here what happens? Anti-vertex and the anteflexion will be there at the first week of, we can say the first trimester of the pregnancy. While the uterus is still pelvic organ, but still it will remain as a pelvic organ only. So this causes the fundus to press on the bladder, resulting in the urinary frequency. So what happens at the first stage of the pregnancy, or we can say the first trimester of the pregnancy, the fundus will be resting over the we can say the bladder. The pressure will be coming over the bladder. So that's why the frequency of the micturition will be increasing for the pregnant mother. Okay, then urinary frequency is relieved early in the 4th month of the pregnancy as the uterus rises out of the pelvis. Okay, so here till the 3 month of pregnancy, the uterus is that is going to have a still anteflexion position. So that's why the micturition will be more. But when the 4th week or the 4th month of the pregnancy comes, that time what happens, the uterus will be raised out. Okay, so that will be coming a little up. So that's why this kind of symptoms will be relieved. Then as the uterus enlarges, according to as the advancement of the pregnancy, according to that the uterus is also going to enlarge the size and shape of it. So it changes from in non-pregnant pear shape to the globular, then to the ovoid. Okay, so it means that from time to time the shape of the uterus is also going to change. Okay, at the early stage, or we can say the non-pregnant mother, if we talk about, the uterus shape will be like pear. Okay, then after when it comes to the pregnancy, that time it will become a globular, and then it will become a ovoid or the spherical also. Okay, then after, early uterine enlargement may not be symmetrical. So here the uterine enlargement are there, it is not necessary all the part will grow symmetrical. Okay, no, not every part will be enlarging same. Okay, so the ovum implants in the upper uterine wall. So here the ovum is going to implant into the upper wall of the uterus. So more frequently on the posterior side. So where happens? Mostly posterior side of the uterus. So uterine enlargement contribute to the two other maternal sign of the pregnancy, that is the Braxton Hicks contraction and the abdominal enlargement. So as we have talked about what is the Braxton Hicks contraction, that is a irregular, spasmodic, and it won't have any rhythm, right? So that kind of, and it will be the painless. So that kind of contraction is known as a Braxton Hicks contraction, and simultaneously there will be the abdominal enlargement also. Okay, then here it has here they have given the explanation of the Braxton Hicks contraction: non-rhythmic, spasmodic, painless, that kind of uterine contraction, and it is going to start from the 6th week of the pregnancy. So these are the detectable on the bimanual examination. So when we do the bimanual examination, that time this kind of uteration can be elicited, or we can find out. Then in the 2nd trimester and during the abdominal examination in the 3rd trimester. So 2nd trimester and the 3rd trimester, we do the abdominal examination. That time this kind of contraction can be found. The increasing in frequency, duration and intensity, as well as attain some degree of rhythm and regularity close to the term. It means that when the term during the antenatal period, this kind of contraction will be painless. There won't be any rhythm, no frequency will be there. But when it comes to the term delivery, okay, or we can say the term pregnancy, when it is about to over and true labor pain is going to start, right? That time this contraction will be converting into the spasmodic also. Then after, the frequency will be increasing, duration, the intensity, that will be increasing, and due to that only the labor pain is going to start. Then at which the time they frequently misinterpreted as a labor contraction. So when this kind of contraction comes, that is known as a labor contraction, or we can say the true labor pain has started. Then after, abdominal enlargement begins at the 4th month. So here the abdominal enlargement till the 3 months, the abdominal girth will be mostly same at is it, but when the 4th month comes, that time the enlargement of the abdomen will be there. of the pregnancy as the uterus become abdominal organ. So what happens after the fourth month of the pregnancy, the uterus is going to become a abdominal organ. Till the third month of the pregnancy, the uterus will be known as a pelvic organ only, but after fourth week it will be known as a abdominal organ. So the abdomen is more prominent when the woman is in standing position. It means when the mother is in a standing position, that time I'll show you the one picture. So in that also you can see this is, we can consider till the 3 months. But when the 4 months is going to start, how the abdomen is enlarged, right? So when the mother is in a standing position, the abdominal will become more prominent one. Okay, so that how, and you can see this is about the last trimester. This is the first trimester, second and the third trimester. So as we have seen that when the mother is in a supine position, that time the abdominal won't be that much prominent. When she is a standing position, that time it will be a more prominent one, right? So abdominal enlargement is also more noticeable in the multiparous woman than the primigravida woman. So here it has written that abdominal enlargement that will be seen more in the multigravida woman. So multigravida, it means the mother who has conceived the pregnancy more than one time. So for them the enlargement will be more. Okay, why? Because already she has conceived the pregnancy. So the enlargement of uterus and everything has been already taken place, right? And another time she has conceived the pregnancy. So what happens? That enlargement was there a little, and more enlargement will be adding inside that. So that's why it is more noticeable for the multigravida, and it is a little there will be the enlargement for the primigravida, but it is more for the multiparous woman. Then after, because of the loss of the muscle tone, why happens? Because the muscle has lost their tone. Okay, that's why. Of the abdominal wall, which was not exercised back into the shape after each previous pregnancy. So whenever the mother is going to conceive a pregnancy, that time whatever the muscle has lost their tone, it won't be coming back to the pre-pregnant state. Okay, somewhat will be the tone will be relaxed only. Okay, so that's why it will be more noticeable for them. Then a pendulous abdominal result as the uterus sag forward and downward. It is for the woman, those who are the mother who have the more weight. Okay, so pendulous abdominal, so the saggy abdominal will be there for them. Okay, so for them also it will be a little noticeable. Then after, other sign of the pregnancy. So till now whatever we have seen the three type of sign, that is the presumptive. So presumptive, whatever the mother is experiencing by herself, that will be. Second one, the physiological changes which is coming, that one. And third one, the test which we are running for the positive of the pregnancy. So that kind of sign and symptoms we have seen till now. Now we'll be talking about what other kind of sign and symptoms will be there. So it is thought that the basal metabolic rate initially falls during the pregnancy. So what happens during the pregnancy, the basal metabolic rate, that is also going to change. It is not necessary that all the 9 months this rate will be increased for the mother. For the certain time it will be less, and for the certain time it can be a decrease also. Then after, then progressively rise throughout the pregnancy as direct result of the metabolic activity of the production of the consumption. So mostly we can say at the starting of the month, the basal metabolic rate won't be much. But when it comes to the second and the third trimester, that time they will be increasing. Okay, so the initial fall in the basal metabolic rate might account for the fatigue. So why the mother is getting fatigue? Because her activity, this basal metabolic rate is higher. That's why she will feel a more weakness or the fatigue. Okay, often encountered during the first trimester. So this will happen at the first trimester. Nausea and vomiting have been attributed to a number of possible causes. So even though the fatigue is also responsible for the nausea and vomiting, if the mother have the nausea and vomiting, she will feel a fatigue. Okay, but their actual etiology is not yet known. So some women, why it is happening, for them which is a causative factor, it is not yet they have found out. The normal nausea and vomiting in pregnancy rarely extend to the beyond the first trimester. Okay, so morning sickness, as we have talked earlier, that will be limited to the first trimester. For some women, it will be less, that they will be, it will be extending beyond the first trimester. Okay. Then after, excessive salivation, that is known as a trilism, okay, is unusual occurrence which may be caused either by the increased acidity in the mouth or by the intake of the starch stimulating salivary gland in the woman who are susceptible to excessive secretion. So here the excessive salivation also we have seen in the presumptive sign, right? So that why happens, because the acidity will be increasing inside the mouth or even though intake of the starch. So that is going to stimulate the salivary gland to secrete the more saliva. Okay. So women who have the pituitarism frequently are the nauseous also. So the woman who have the more salivation, they will feel that they are about to vomit. They will become more nauseous. Okay. Then after, fetal contributing to the diagnosis of the pregnancy. So here, what fetal changes are coming, that is going to help to the understand the pregnancy, or we can say the how we can understand the pregnancy is positive. Okay, so here anatomical. So the combination of uterine enlargement, thinning of the uterine wall, then the uterus becoming the abdominal organ, unable to detect the number of sign of the pregnancy. So number of the sign of the pregnancy, or we can say the sign of pregnancy, that is depend on this different variable, like the uterine enlargement, thinning of the uterine wall will be thinning, then after the uterus will become the abdominal organ. Okay, so that is a positive sign of the pregnancy. So in the second trimester, which was previously inaccessible, so previously it will be not accessible. The precious time when the fetal heart tone are heard and the quickening is felt with the thinniness or the obesity of the individual woman as well as with the parity. So here it has written that will become a precious time for the mother when she will listen her baby's heart rate for the first time, or even though when the baby is moving inside her womb, it will become a really precious time for the mother. Okay. So, in the multiparous woman, the abdominal muscular has hypertrophied and stretched earlier. It may be thin enough to facilitate the eliciting of the following sign of the pregnancy week or 2 weeks earlier than the primigravida. So, it has written that the multiparous woman is there, right? Their muscles and everything will become very thin, okay, than the primigravida mother. So usually the changes are coming, the sign, the diagnosis of pregnancy are coming, right? That will be early. How much? That will be a week or the 2 week earlier for the for the multiparous woman, and the 1 or the 2 week later the primigravida mother will be developing the sign of the pregnancy. Then after, the fetal heart start beating at the 6th week, that is from the 4th week post fertilization. So that is what on the 4th week of fertilization, or we can say the 21st day after the fertilization, the tertiary stem villi is there, that is going to fill with the blood. Okay, so that's why from that moment the heart rate will be listening. So can be heard from by the 20th week of pregnancy with the stethoscope, with the fetoscope during the abdominal examination of the mother. So that will be heard from the fetoscope from the 20th week of the pregnancy. However, it can be heard between the 12th to 20th week. So from 12th to 20th week we can listen. Then after, within the ultrasonographic instrument, if you want to listen before, so you have to go for the USG. So the fetal heart tone must be differentiated from the 2 other sounds. So there are also other 2 sounds will be there. So you have to try to differentiate which is the fetal heart sound and which is the other sound. Okay. So here it has written the uterine suckle. So a soft blowing and systematic murmur heard low down at the side of the uterus. So uterus also will have a little sound. Why? Because it will have the amniotic fluid also. Okay, so that will be also due to that, if we can say the thrill of the fluid, that also can be listened from the stethoscope or the fetoscope. So on the best on the left side, and the sound is due to increase in the blood flow due to the why dilated uterine vessels and synchronous with the maternal pulse. So here why it is happening, because the blood flow is going to increase inside the uterus also, and even though you can listen the sound of the mother's pulse also. Okay, then after the phonic suckle, what is that? So a sound of the blood rushing through the umbilical artery. Even though this kind of voice also you can listen while you put the bell of the stethoscope over the abdomen. Okay, so it is soft blowing murmur synchronous with the fetal heart sound. Okay, so that time as you have seen in the two kind of sounds will be there. The first one, it was also flow of the blood that will be synchronous with the maternal heart rate. Okay, and other is also the blood rushing, also the blood flow sound, but along with the fetal heart sound. So this kind of sound also you can listen, but you have to differentiate which is the fetal heart rate. Then after, weak fetal movements start in the 3rd month of pregnancy, and by the 20th week they are strong enough and the uterine wall is thin enough for the term to be felt and properly diagnosed during the abdominal examination. So here it has written, when the 3rd month of the pregnancy comes, from that a little fetal movements will be felt by the mother. Okay, so but it will become strong enough when it comes to the 20th week of the pregnancy. So that will be done if you do the abdominal examination. So the mother may be aware of the fetal movement around the 18th week. So when the mother when she reaches at the 18th week of pregnancy, she will be feeling this fetal movement by herself. So this movement increase in the intensity over the weeks, from the gentle fluttering to the unmistakable fetal kicks. So here what happens? So at the starting point they will be moving. Okay, so mother will be feeling that the fetus is doing the movement. But at the later stage, a mother will be feeling that the baby is giving the kick. Okay, so kicking of the fetus also can be felt by the mother. So the time when she feels the first fetal movement is called as a quickening. So at the first time the mother is feeling that movement is known as a quickening. So that is, it means that the perception of the life. So it means that the life is growing inside the baby, inside the mother's womb. Then after the 20th week, fetal outline can be palpated during the abdominal examination. So it means that when you do the abdominal examination, okay, over the mother's abdomen, that time you can feel the fetal outline. So you can understand where is the extremity, where is the fetal spine, you can be feel. Then this is not a definitive diagnostic sign, because sebaceous myomas may feel like the fetal part also. So myomas or something is there, that is also going to feel like the fetus is there inside that. So ballotment can be elicited abdominally around the same time. So if you do the ballotment also, though you can be feeling. So that will be from the 20th week to the 27th week. Then in this sign, a sudden tap of the uterus causes the fetus to sink in the amniotic fluid and rebound to the strike the gentle against the finger of the examiner. Then ballotment is possible at this time because there is a large volume of amniotic fluid in the relation to the size of the small fetus. So here the ballotment can be done very easily. Why? Because good amount of the amniotic fluid will be there and the small fetus will be there. So it can be done really easily. Or we can say it is also, they have also relation between them. Then after this grossly change the later in the pregnancy. So this will be changed in the later of the pregnancy. Okay, why? Because at this third trimester, the baby growth and development will be at the peakest level, right? So amniotic fluid will be less and the baby will be larger. Okay. Hello everyone, we will see further in the diagnosis of pregnancy. So in that hormonal pregnancy test, so what it is, so mostly this is the what we are doing at the home when the woman is missing her first periods, right? So pregnancy tests are based on the production of the chorionic gonadotropin by the syncytial trophoblast. So here the syncytial trophoblast that will be, you might remember that we have seen in the fertilization. So when the blastocytes are there, that is going to further divide and they are going to make the two outer layers, right? So one layer that is known as the inner cell mass and the outer that is the syncytial trophoblast. So that cell particularly, they are going to produce the HCG hormone. So that is the human chorionic gonadotropin hormone, right? So here pregnancy test that is depend on this particular hormone only. So cell during the early pregnancy. So in the early pregnancy, this cell is going to produce the HCG. So the hormone HCG is secreted into the maternal bloodstream. So here the HCG is one that is going to secreted inside the bloodstream of the mother, where it is present in the plasma. So mostly this will be absorbed inside the plasma of the blood. So it is then excreted in the mother's urine. So first that will come inside the blood of the mother. Then after a little time that will be excreted inside the urine of the mother. Then the hormone HCG is first detected in the urine about the 26 days after the conception. So this is going to be detected HCG after the 26th week of the conception, or we can say 26 days after the conception, and is excreted at the rate which the increases rapidly between the 30 to 60 days. So here it has written when the 30 and 60 days comes after the conception, that time the production will be increases. So peak level occurs between the 60 to 70 day of the gestation. So when the 60 to 70 days comes, that time the excretion also and the level of HCG will be at the peakest level. Then the level then gradually decreases to the low between the 100 to 130 days. So when the 100 to 30 days comes, that time this production is going to be reduced. Then after, it will be maintained at this level throughout the remaining week of the gestation. So what happens after the 130 day of the gestation, whatever the level is there at that time, that will be maintained throughout the pregnancy. As you have seen, we can have a conclusion in this paragraph in that HCG level that is going to increase at the first starting of the pregnancy. Okay, so after the conception, the syncytial trophoblast is there that is going to secrete the HCG level. So that time it will be more, but it will be gradually it is going to increase. But there will be a one time when the level of the HCG will be at the peakest. Then after it will become a little less. Then after it will be maintained throughout the pregnancy. Then after, pregnancy test kit for the home use. So here the pregnancy kit will be there. Okay, so that can be used by the mother at the home itself. So how to use and what it is, we will see. So several self-use pregnancy tests are now available in the India. So there are so many tests are there, or we can say the devices are present in the market in the India. So they can have anyone and they can do the test at the home itself. So this Food and Drug Administration, that is the FDA, approved the product by easy to use and give the quick result. So who has given this? So that is the FDA has given the approval for this, and that's why, and we can use this and within the seconds we can have the result of it. Then after, the strip tests are performed to discover the level of HCG hormone in the urine. So here, as we have seen earlier, the first HCG level is there, that is that hormone is going to secreted in the bloodstream of the mother. then after it will be secreted inside the urine, right? So here we are taking the strip of the pregnancy and we are keeping or we are using the few drop of the urine of the mother, and by that we can determine or we can detect the level of the this HCG hormone. So the kit contains instruction for use and give the result within the 20 or we can say 15 to 20 minutes. So here it has given the maximum time for that. Okay, so here the kit contain the instruction for the use. So there will be the guide and there will be the steps has been given. So read that and you can use it at the home itself. The result step reading indicates if the positive or negative for the pregnancy or need to be repeated. So here the indicator, so result, how you can identify or how you can understand whether it is a positive or negative. So there will be some red color indicator that will be showing negative and the positive one. So some of the pregnancy detection kit for home use that are presently available in India are, so which all are the brands are available in the India. So we will talk about that. So in that ICAN is there, so that is a one-step pregnancy device. Then after first response pregnancy kit, then after the Velocite is pregnancy detection kit, and then after the make sure pregnancy test kit. So there are the different test devices are available in the market. So whatever the available are there, you can use it. So here they have shown that this is how it is going to be there. As you can see, the two indicators are there. If the two line it is there after keeping the drops of the urine, so that will be keeping here. Okay, there will be one dropper. Use the dropper. Then after from dropper you have to take some amount of the urine inside that, and that using that dropper you have to pour some 2 to 3 drops to the here. Okay. Then after if the two line comes, it means it is a positive. If the one line comes, then it means it is a negative. And after dropping or after pouring this urine, if no result is coming, so it means it is invalid. So in this case you have to go for the another test. Then after this one, nowadays they are using mostly that is the Prega News. Okay, and this is this different devices are available in the India. So till now we have seen about the diagnosis of pregnancy. So whatever the changes are coming, presumptive, then after the probable sign and the positive sign. So this question they can ask in the theory exam also, or else we can say the practical exam also. They can ask which all are the, what is the meaning of the Jack-Meyer sign, then what is the meaning of the Chadwick sign, Palmer sign, Hagar sign, like that. Okay, so this is really important for the exam point of view also. So thank you.